So yes, let me check, am I audible? Is the screen clear? So yes. Hello everyone. So am I audible? Is the screen clear? We can start the session. High yield anatomy MCQs. This is conquering the NEET PG 2022 examination. So let's start with the session now. So meanwhile the students is joining, I would like to tell about the brief introduction about myself and about the platform of Unacademy, so that we can interact among ourselves. So myself Dr. Monalisa, MD Anatomy from Armed Force Medical College, Pune, and I am here to describe the important MCQs targeting NEET PG 2022 examination. So let me talk about firstly about the special class features which is present on the Unacademy platform. What do you mean by the special free sessions on the Unacademy? This is a session which is free for you. You can participate in this session, which is an interactive live session. Polls are conducted. You can respond to a poll in a better way and you can understand the topic concepts. Raise your hands and get out the previous year MCQs targeting this. Okay. So my dear aspirants, what I want to tell everyone. So let's start with the session that what are the benefits of joining this session. So the benefits will be, if I talk about this, the benefits will be, okay, so I am audible, and the benefits of seeing this session is you are not going to ever miss this session. Okay, lecture notes are provided to you. Once the session is finished, you can download the PDF notes anytime, anywhere, read from the top educators of Unacademy platform. So also I want you to tell about the previous year NEET PG Anatomy MCQ series which I have started on the Unacademy special free session. So the 11th session or the 11th part of the previous year NEET PG Anatomy MCQs, the timing is 4:30 p.m. today itself. This is the 11th part. So you can be the part of this session. The students who are watching the session for the first time on the Unacademy platform free session, they should download the Unacademy app. So they should download the Unacademy app, and thereafter they should find their goal as NEET PG. So they will find their goal as NEET PG, and the link provided by me and an unlock code of ANAT10 can be used so that you can be present live for the session, which is highly beneficial for you. So today's session is 11th session, 4:30 p.m. 31st December today. So be present live. And also I want you to tell about the plus subscription of Unacademy, where all 19 subjects are studied in a very systematic way. You can access both live sessions, you can access both live and recorded version. You can study from India's top educator, you can compete in live test and quizzes, study on the device of your choice, and you can have an access of more than 25,000 MCQs. Okay, so this is highly beneficial for you, my dear aspirant. This is highly beneficial for you. All the clinical MCQs of all 19 subjects can be targeted, which is made by the top educators of Unacademy platform, and you can solve these MCQs and you can get a better rank in the competitive examination. So yes, okay, now with soon, if you are taking 1 year of subscription and more, you are provided with the printed notes of Unacademy. So I would also like to tell you about the iconic subscription. So when I am talking about iconic subscription, it means merging of both the prep ladder and Unacademy. That means Unacademy benefits and the prep ladder benefits, which both the benefits can be availed by you. Okay, all the Unacademy benefits and along with the prep ladder benefits can be availed by you. You can be the part of clinical integrated essentials, video lectures from the dream team, QBank 3, rapid revision, snapshots and Dresser Deem notes. All these can be availed by you. It is highly beneficial for you. My dear aspirants, before starting the MCQ session, I want to show you this slide where the comparison of plus and iconic subscription has been shown, and you can be the part of these session. You can use my code ANAT and get 10% discount, and you can avail the opportunity. So just grab this golden opportunity and take the subscription of Unacademy. It is highly beneficial for you. Okay, so let's start with the session now. All the best. So let's start with the first MCQ. Let's start with the first MCQ, my dear aspirants. Trapezius attaches to which of the following reason? Trapezius attaches to which of the following reason? Trapezius attaches to which of the following reason? Lateral 1/3 of the clavicle, conoid tubercle, subclavian groove, or the trapezoid line. trapezius attaches to which of the following reason? Your time starts now. 4 options are there. Mark the correct answer. So 30 seconds will be given to you and you have to mark the correct answer. Whether it is lateral 1/3 of a clavicle, convoid tubercle, subclavian groove or trapezoid line. The correct answer is lateral 1/3 of the clavicle. My dear aspirants, the correct answer is lateral 1/3 of the clavicle. Okay, so yes, let me show you this diagram. So here you can see the outline of, here you can clearly see the outline of, okay, so let me show you this diagram. So here you can clearly see the outline of the clavicle. This is the clavicle bone which has been shown here. Okay, this is the clavicle bone. So okay, this is the clavicle bone and this part is the medial part. So this is the medial part of the clavicle and this part whole is the lateral part of the clavicle. This whole is the lateral part of the clavicle. See here. So from the lateral part of the clavicle, so from the on the lateral part of the clavicle, you can see the attachment of the muscle which is shown here is the trapezius muscle. So this is attached on the lateral part of the clavicle, as you can see here. So exactly on the lateral aspects, this is the lateral aspect, the trapezius muscle is attached. So we have got the correct answer A. Now my dear aspirants, we have got another options also, and let's discuss that also before proceeding to the next MCQ. All those who have joined is having any kind of doubt, they can ask me. Okay, so now let's talk about the trapezius muscle origin insertion. So this is the lower part of the trapezius muscle. Actually trapezius muscle is getting origin from the occipital bone and also from the vertebrae. It is upper middle trapezius, as you can see, lower down towards the whole of the thoracic vertebra spine, and it inserts onto the spine of the scapula, acromial process of the scapula, and it is also taking attachment from the lateral aspect of the clavicle, which we have seen. Now let me show you another diagram where you can appreciate this is a this is the clavicle which inferior surface has been shown, and on the inferior surface you can see this is the subclavian groove, and there is also convoid, tubercle and trapezoid line. So I also want to tell you about the convoid, tubercle and trapezoid line attachment. So see here, when you are seeing the this is the clavicle as shown in this diagram. This is the clavicle, and just below it you can see the muscle which has been shown here. You can see the muscle. So you are appreciating this muscle which is shown on the inferior aspect, and my dear aspirant, this muscle which you are seeing here is the subclavius muscle, and subclavius muscle is attached onto the subclavian groove of the clavicle. Subclavius muscle is attached onto the subclavian groove of the clavicle. So see here. Now the other important point is convoid, tubercle and trapezoid ridge of the clavicle. So from the convoid, tubercle and trapezoid ridge, you can see the parts of these two parts are actually the parts of the ligament, that is coracoclavicular ligament. So these are the parts of coracoclavicular ligament. This is the trapezoid and this is the convoid part. So clearly with this description, it is clear that the correct answer will be lateral 1/3 of clavicle giving attachment to the trapezius muscle. Got it everyone? Let's move on to the next, that is question number 2. Okay, which is not true in respect to ulna and the radius bone? Which of the following statement is incorrect about the incorrect statement about the radius and ulna bone? The options are brachialis muscle attaches to the tuberosity of ulna. Ulnar styloid process is larger than the radial styloid process and extend farther distally. Head of the ulna lies distally, whereas head of radius articulates with the humerus. Okay, ulna is medial to radius bone in the case of anatomical position, and shaft of these bones are firmly bounded together with that of the interosseous membrane. So yes, we have got question number 2. We have got 5 options here, and your time starts now. Which is not true in respect to radius and ulna? Which is the incorrect statement, my dear? Your time starts now. Mark the correct answer. Whether it is right and wrong, you can give the correct answer. Which is the incorrect statement? Your time starts now. which is the incorrect option. And the correct option is, the correct answer is C. Why? Because head of ulna lies distally is absolutely wrong. More distally is the radial head, not the ulna head. Okay, so this is the incorrect option. Other than that, brachialis muscle attachment on the ulnar tuberosity is absolutely correct. Ulnar styloid process is larger than radial styloid process is also absolutely correct statement. Ulna is medial bone in respect to radius is absolutely correct, and shaft of radius and ulna is connected to each other by interosseous membrane, that is also a correct statement. Only C option is the incorrect statement. So my dear aspirants, I would like to show you various images so that your concepts get cleared. So you can see here the radius and the ulna bone has been shown to you. So this is the radius bone which has been shown. Okay, and this bone which you are seeing is the ulna bone. And my dear aspirants, here you can clearly see the styloid process of both. So this is the styloid process of, let me use another color, so I will use green color. So this is the styloid process of ulna, and this is the styloid process of radius. So which is more distally, which is more lower down? The styloid process of radius is lower down to the styloid process of ulna. It is quite clear in this image that lower down or the lower limit is of the styloid process of radius, not of the ulna. Okay, absolutely right. Now, other than that, what you can see here, this is the interosseous membrane which has been shown. This whole is the interosseous membrane. Okay, so there is an interosseous membrane which has been shown, which is forming a link between the radius and ulna. So that is also correct. Other than that, I would also like to show you the another diagram where the dorsal tubercle of the radius and ulnar styloid process has been shown. Very clearly, the styloid process of radius is lying at a lower limit or more distally in comparison to the ulnar styloid process. So I think it is clear to you. Let's mark the next one, that is question number 3rd. So all of you, let's mark the next one, that is question number 3rd. All the best. Okay. Choroid plexus of lateral ventricle is formed by. Choroid plexus of lateral ventricle is formed by which of the following? So your time starts now. Mark the correct answer. Choroid plexus of lateral ventricle is formed by anterior choroidal artery, posterior choroidal artery, posterior inferior cerebellar artery, or both A and B. Which is the correct one? Choroid plexus of lateral ventricle is formed by which of the following component, or which is the capillary source, arterial source for the formation of choroid plexus, which is located in between the layer of pia mater choroida, which is the pile sheath, which is also having the ependyma attached to it. So mark the correct answer. Your time starts now. Your time starts now. Lateral ventricle choroid is formed by which of the following two sources? One source or two sources. Any of the option A, B, C or D is correct. You can mark the correct answer. My dear aspirants, the correct answer is both A and B. Both A and B is the correct answer. So actually anterior choroidal artery and the posterior choroidal artery. These both arteries, okay. So both anterior and posterior choroidal arteries are giving blood, are providing and forming the choroid plexus in the lateral ventricle. Okay, so these both is the correct answer. So if we have to choose one answer, we will go with both A and B, which is contributing to the formation of the choroid plexus of lateral ventricle. Lateral ventricle is one on each side and which is covered by septum pellucidum. Let's move on to the next, that is question number 4th. Which of the following correctly describes the flow of cerebrospinal fluid? So you can see here there are 4 options and you have to trace the correct order of. So you have to trace the correct order of the flow of cerebrospinal fluid. Question number 4th. Yeah, hello everyone. So whether it is from lateral ventricle to cerebral aqueduct and then passing through the third ventricle, interventricular foramen or the fourth ventricle, then via medial lateral apertures and subarachnoid space. The second option is from lateral ventricle through interventricular foramen and third ventricle. So you can see combination has been given. So I am not reading it out for you. I am just waiting for 30 seconds. You read all the option A, B, C and D and then give me the correct answer. What is the exact flow of cerebrospinal fluid? So one thing is clear that the maximum amount of cerebrospinal fluid is formed by the choroid plexus of lateral ventricle. Subsequently, you have to trace the whole flow chart and you have to trace how the flow of CSF occurs. So 4 options are there, mark the correct answer. Your time starts now. Okay, so my dear aspirants, the correct answer is, actually I would like the flow. I would write to like the flow. So actually lateral ventricle is forming the major amount of choroid plexus and thereafter it will pass through. So actually B option is correct. It will pass through interventricular foramen of Monro. It will pass towards the third ventricle and from the third ventricle there is a gap that is called as cerebral aqueduct. So via gap of cerebral aqueduct it will pass to fourth ventricle and we have got 2 foramens in the roof of fourth ventricle, that is foramen of mesendae and lateral apertures. So lateral apertures is also called as foramen of Lusca. So median, so these are the foramens which is found in the roof of fourth ventricle. So foramen of mesendae is the foramen found in the roof of fourth ventricle along with the 2 lateral apertures and this will communicate to the subarachnoid space. This will communicate to the subarachnoid space. Okay, actually these 2 foramens of the fourth ventricle roof will form a communication with the subarachnoid space. That means via fourth ventricle roof there is communication between the ventricular system of the and that of the subarachnoid system, and this is the correct pathway of the flow of CSF. So actually I have written this also, the same thing which I have just told you, it has been written also here. You can just see here. Cerebrospinal fluids flow from each of the lateral ventricle through an interventricular foramen of Monro reaches the third ventricle, then cerebral aqueduct say fourth ventricle may, and finally the 2 apertures in the roof it will, that is foramen of mesendae and Lusca, the medial and the 2 lateral opening, it will reach to the subarachnoid space. So clearly B is the correct answer. Okay my dear aspirants, let's move on to the next, that is question number 5th. Let's move on to question number 5th. All of the following statement are true regarding the structure marked in the image. So firstly, regarding the structure marked in the image, I want to tell the arrow mark structure. Arrow mark. So I want to tell arrow mark structure. So here I mean to tell arrow mark structure. Okay. So can you see black color arrow mark structure has been shown. I am not talking about the green color structure. Okay. The green color structure which has been shown here, if we talk about the green color structure, it is the sickle shaped fold of dura mater. It's the sickle shaped fold of dura mater which is flux cerebri, which is flux cerebri. Okay, and this flux cerebri is resting over, this flux cerebri is resting over this sheet of dural sheath. So you have to firstly identify this arrow mark structure and then tell me which of the following is a wrong statement about this. So its anterior border is free and concave, it encloses the transverse sinus, it encloses sigmoid sinus, its extension of the dura mater separates cerebellum from the inferior part of the occipital lobe. My dear aspirants, so I got a correct answer from Amitabh Behra. Yeah, Amitabh Behra is absolutely right. It encloses sigmoid sinus is absolutely wrong statement. So Amitabh, can you tell me which structure is this? Which is the arrow mark structure? Can you identify which is this arrow mark structure? So just let me know which is this arrow mark structure. Okay, so the arrow mark structure is tentorium cerebelli. The first thing which is clear to you, this was exactly the arrow mark structure which has been. So this was exactly about this arrow mark structure which has been asked. The MCQ is targeted about this arrow mark structure, and this arrow mark structure is tentorium cerebelli. This is tentorium cerebelli. So tentorium cerebelli is the correct answer. Okay, tentorium cerebelli is the correct answer. Okay, now what you can appreciate over the tentorium cerebelli, the flux cerebri is also resting sickle shape, and this tentorium cerebelli is actually forming a protection for the cerebellum, small brain. Why? Because above this, which structure is resting? Occipital lobe of cerebral hemisphere is resting. Now the next important point is, what does this include? So here you can clearly appreciate this is the anterior border and this is the posterior border. So yes, posterior border is the attached border and anterior is the free border. So this is also the correct statement. Now let's talk about the incorrect statement. So I would also like to enlarge this image. So when I am enlarging this image, you can appreciate that this is the sinuses which is enclosed by it. So two sinuses are enclosed by it, and it has been shown in this diagram also. Two sinuses. See here, two sinuses are enclosed by it. Okay, so the one sinus here, this is the superior petrosal sinus and this is transverse sinus. So you can see here two sinuses which is enclosed by it is superior petrosal sinus, anterolaterally, and posterolaterally it is enclosing transverse sinus. So it is quite clear here by seeing this image that it is not enclosing sigmoid sinus. So that is the wrong statement. So clearly it encloses sigmoid sinus is absolutely incorrect about the tentorium cerebelli. Got it, my dear? Yes, Amitabh. So let's move on to the next, that is question number 6. All the best to everyone for question number 6. Which is not a branch of radial nerve? Which of the following is not a branch of radial nerve? Which of the following is not a branch of radial nerve? Posterior cutaneous nerve of arm, posterior cutaneous nerve of forearm, inferior lateral cutaneous nerve of arm, superior lateral cutaneous nerve of arm. Question number 6. Which is not a branch of radial nerve? Which of the following is not a branch of radial nerve? So yes, your time starts now. You will be provided with 30 seconds. Mark the correct answer. Not a branch of radial nerve. Which of the following is not a branch of radial nerve? I got an answer from Amitabh. What about others? Amitabh Behra has given the answer and he is perfectly right. Inferior lateral cutaneous nerve of arm. So can you tell me, inferior lateral cutaneous nerve of arm is a branch of which nerve? Inferior lateral cutaneous nerve of arm is a branch of which nerve? My next question or MCQ is that if inferior lateral cutaneous nerve of arm, this is a correct answer, is not a branch of radial nerve. So it's a branch of which nerve? What is the source? So actually inferior lateral cutaneous nerve of arm is a branch of axillary nerve. Rest all posterior cutaneous nerve, rest all posterior cutaneous nerve of arm, posterior cutaneous nerve of forearm and superior lateral cutaneous nerve of arm. All these are the branches of radial nerve. So we have got C as the correct answer. Let me show. Posterior cutaneous nerve of arm, posterior cutaneous nerve of forearm, inferior lateral cutaneous nerve of arm, all these branches are radial nerve. When we are talking about superior, Amit, it's a branch of axillary nerve. So superior lateral cutaneous nerve, it's a branch of axillary nerve. So please note down, superior lateral cutaneous nerve which was given in the option is exactly the branch of axillary nerve. It's a cutaneous branch of axillary nerve. Let's move on to the next, that is question number 7th, 8th, okay, 8th. Let's move on to 8th number MCQ. The structure that lies, which of the following structure is exactly located lateral to distal tubercle? Which of the following structure is exactly located lateral to distal tubercle? So here options are extensor pollicis longus A option, extensor carpi radialis longus B option, brachioradialis C option, and extensor carpi ulnaris is the D option. Structure lying lateral to distal radial tubercle. Which of the following structure is located lateral to distal radial tubercle? 4 options are there, A, B, C and D, and you have to mark the correct answer. Question number 8. I got an answer from Ashwani Mishra A and I got an answer from Amitabh Behra B. So the correct answer here is extensor carpi radialis longus. B is the correct answer. Actually, ECRL and ECRB, these are the 2 tendons of the second compartment, extensor compartment, and EPL is the third extensor compartment tendon, and distal radial tubercle is located in between, and in between these 2 structures there is location of distal radial tubercle, And my dear aspirants, if we are talking about extensor carpi radialis longus, the location of these tendons will be lateral and the location of extensor pollicis longus will be medial. Okay, will be medial. So I would like to show you the same thing via an image and your concepts will be clear. So let's move on with the image. See here. So yeah, let me just highlight this diagram. So here what you can see, firstly I would like to highlight the location of Lister or distal tubercle. What is this? This is called as Lister tubercle, or you can call it as a dorsal tubercle. So both are similar, Lister or dorsal tubercle, okay. Lister or dorsal tubercle, both are same, which is lying on the dorsal aspect of the radius. So outline of the radius bone is also shown. This structure which you are seeing is the outline of the R for radius bone. This is the outline of radius bone. This whole is the outline of radius bone. Now let's focus on to the tendons which has been shown. So what you can see, 2 tendons has been shown. So let me mark this tendon with green color. Okay, this is EPL and these 2 tendons are ECRB and ECRL. So these 2 tendons are here. So we have to mark the correct answer in relation to Lister tubercle. Now you can clearly see that these 2 tendons and these 2 tendons. Okay, so we know that radius bone is lying laterally and the ulna bone is lying medially. So you can see the tendons of extensor carpi radialis longus and extensor carpi radialis brevis. It is lying lateral, it will lie lateral. You can say these 2 tendons is lying lateral and EPL tendon will lying medial to Lister tubercle. In relation to Lister tubercle, extensor pollicis longus tendon is medial and the extensor carpi radialis longus and brevis is lying laterally. So this is clear in this image. This is quite clear in this image. So no doubt about this MCQ. This is quite clear. So also it is important that you should know all the structures passing through the individual extensor compartment. My dear aspirant, it is also important that you should know all the structures passing to individual compartments, extensor compartment. This is also favorite MCQ. So through the first compartment, second compartment, third, fourth, fifth and sixth. There are 6 extensor compartments. Please write down the structures passing through this. I am talking about extensor compartments. So I will write quickly the structures passing. So the first compartment structure passing is abductor pollicis. The structures passing is abductor pollicis longus and extensor pollicis brevis. Second say ECRL and ECRB, extensor carpi radialis longus and extensor carpi radialis brevis. Absolutely right, Amitabh Behra is absolutely right. Third say EPL, extensor pollicis longus. Fourth say extensor digitorum, extensor indicis. one artery and one nerve. So artery is anterior interosseous artery and the nerve is pin. Fifth से क्या जाता है? Extensor, digiti, minimi muscle, and last compartment or the medial most compartment say ECU, extensor carpi unlaris. Extensor carpi unlaris. So done with this, let's move on to question number 9. All the best. Let's move on to question number 9. True statement about the boundaries of auscultation is, which of the following statement is the true statement about boundaries of triangle of auscultation? Triangle of auscultation. Which of the following statement is true statement about boundaries of triangle of auscultation? Question number 9, your time starts now. Mark the correct answer. Your time starts now. Laterally bounded by latissimus dorsi, medially bounded by scapula, inferiorly bounded by latissimus dorsi, or laterally by trapezius. According to you, which is the true statement about triangle of auscultation? Your time starts now. Mark the correct answer. I got an answer from Suprita Pal. Okay, Suprita Pal, Afzal C, Amitabh Behra is telling C. The correct answer is C. Absolutely right. The correct answer is also C. Okay, inferiorly bounded by latissimus dorsi is absolutely correct answer. When we are talking about triangle of auscultation, this is not overlapped by any muscle. So, it is lying directly in contact with the lower lobes of the lung. So, breath sound can be heard directly. When you go to the OPDs also, breath sound is heard better when we approach it from the posterior aspect or the back. So exactly the area where the where we hear for the breath sound is the triangle of auscultation. In the floor of it lies the 6th intercostal space. 6th, 7th rib is located here and 6th intercostal space, and the lower lobes of the lung is located here. Let's talk about the boundaries. Let me show you a diagram and let's talk about the boundaries of triangle of auscultation. So here we can clearly see that this is the triangle of auscultation. Let me use this color to help you to understand. Okay, now if I talk about boundaries, so lower down, inferiorly it is bounded by latissimus dorsi. Inferiorly the boundary is by latissimus dorsi. Latissimus dorsi is forming the inferior boundary. Okay. Trapezius muscle, as you can see, is lying supro-medially. So, trapezius muscle is lying on the supromedial aspect, and also we have got medial border of scapula. So, the other will be the medial border of scapula. Third boundary is medial border of scapula. So, by seeing this diagram, it is clear that inferior or the lower part of the boundary of triangle of auscultation, which is utilized for hearing the breath sound, is the triangle. Yes, Ashwani, please. So, last image, want to take a snapshot of Lister tubercle. Okay, sure. Why not Ashwani Mishra? So, you want to see the snapshot of Lister tubercle. Okay. So many labelings are there, you will get confused. So, let me rub this labeling and you just take this snapshot if you want, and to understand the location and the relations of the. So, yes, you can see this is the location of, so here the dotted line, this is exactly the location of Lister tubercle. This is Lister tubercle or dorsal tubercle. Okay, done. So, is it okay? Lister tubercle. So, done. Now, we have done with this. So, clear the triangle of auscultation. Okay, my dear aspirants. So, let's move on to the next, that is question number 10th. All the best for the question number 10th. Okay, damage to which of the following nerve leads to sensory loss of the adjacent sides of the great toe and the second toe, and also causes impaired dorsiflexion of the foot. So, damage to which of the following nerve is leading to sensory loss on the adjacent sides of the great and that of the second toe, and it is also involved for the impaired dorsiflexion of the foot. The options are, superficial, peroneal, lateral, plantar, deep peroneal, or the sural nerve? According to you, which is the best answer? According to you, which is the best answer? 4 options are there. Mark the correct answer, my dear aspirants. So Aswani is telling it's C. What about others? Aswani Mishra has already given his answer. Okay, great. Great explanation, dear. So I am getting correct answer from Amitav, Behra and Ashwani Mishra. They are giving elaborate answer along with the root values. Okay, great. So yes, and Afzal is also absolutely, all of you are absolutely right. This deep peroneal nerve is the correct answer. Let me show you. So deep peroneal nerve, which is one of the branch of common peroneal nerve. So when we are talking about deep peroneal nerve, this is the branch of common peroneal nerve, and one of the important feature is that it is, can you see this blue area? This is the area between the first toe, great toe and the second toe. So in between the web space on the dorsum aspect, in between the first and the second toe, the area of innervation is by deep peroneal nerve. Okay, L4, L5 commonly is the root value, and this diagram is exactly showing you the innervations area of medially on the leg is the saphenous nerve, superficial peroneal nerve and common peroneal nerve. All the area of cutaneous distribution has been shown. So with this, let's move on to the next, that is question number 11th. Let me just rub this. Okay, so your time starts now. Root value of common peroneal nerve is, what is the root value of common peroneal nerve? It's dorsal branch of ventral rami of L4, L5, S1, S2. Whether it is ventral branch of ventral rami of L4, L5, S1, S2, dorsal branch of ventral rami of L4, L5, S1, S2, or ventral branch of L4, L5, S1 and S2. So see here, 4 combination is there. Your time starts now. Mark the correct answer. Root value of common peroneal nerve. Question number 11th, mark the correct answer. Whether it is A, B, C or D. Okay, whether it is ventral branch or ventral rami or dorsal branch. Please mark the correct answer. Ashwani, okay, is giving me B as the correct answer. Dharmendra Singh Jayant is telling C. Okay, so let me come up with the correct answer, and Afzal is telling, oh, mixed bundle of answers are A, B, C, D. सब A नहीं, किसी ने A नहीं बोला है, लेकिन B, C, D बोला है. So correct answer, which is the correct answer? I guess ventral branch. No, common peroneal nerve is dorsal branch of ventral rami. So please note down, common peroneal nerve is dorsal branch. Common peroneal nerve is dorsal branch of ventral rami of L4, L5, S1 and S2. So my dear aspirants, it's a dorsal branch. So it's C is the correct answer. C is the correct answer. It's a, so tibial nerve is the, so please note down, tibial nerve is the ventral branch. Tibial nerve अगर होता तो वो ventral branch of ventral rami of L4, L5, S1. This is the root value for tibial nerve. Okay, but we are talking about common peroneal nerve. So it is dorsal branch of ventral rami of L4, L5, S1 and S2. It is the smaller component of sciatic nerve. Please note down, common peroneal nerve is a smaller component of sciatic nerve. It's a smaller component of sciatic nerve. So C is the correct answer. So I will show you. See here, this is the sciatic nerve which is arising from anterior primary rami of L4, L5, S1, S2 and S3. Now when I am talking about, when we are talking about tibial nerve, so see here, tibial nerve में क्या लिखा है? VD. VD means ventral branch. So tibial nerve is ventral division of the ventral rami of ventral division of the ventral ramis of the L4, L5, S1 and S2. And when we are talking about the common peroneal nerve, which I am highlighting with yellow color, so what you can appreciate, this common peroneal nerve, it is by DV. What is DV? Dorsal division of the ventral rami of L4, L5, S1 and S2. Is it clear? All of you are clear with your doubt? Just a primitive thing, just requires 1 or 2 revision, that's all. Correct? Everyone is knowing, that is known to me. So absolutely correct. Let's move on to the next. Oh, it's okay, dear. It's okay. Mistakes happens, confusion happens if you are reading. अगर आप पढ़ रहे हो तो confusion होगा, और अगर कोई पढ़ाई revision नहीं हो रही है तो कोई confusion नहीं होता. So that is a good part. That is positive thing only. Okay. So let's move on to question number 12. We study anatomy so many times. At times we are also confused. So it is a common thing. It's a common thing. Nothing to worry. Question number 12. 12th one, which of these statement about adductor canal is incorrect? Which of the following statement about adductor canal is incorrect? It's a communication between femoral triangle and popliteal fossa. It is bordered posteriorly by adductor longus and magnus. It contains nerve to vastus medialis, and it contains the femoral artery exit through the hiatus in adductor longus. So which is the wrong statement? Your time starts now. You will get 30 seconds. Mark the correct answer. Mark the correct answer for question number 12. So yes, I got an answer from. So question number 12. So I think no one has marked till now, or marked. Okay. Okay. Ashwani, it contains nerve to vastus medialis is wrong. Okay. So C. Ashwani Mishra Afzal is telling C. What about others? Which is the incorrect statement? Which is the incorrect statement? Amit Behra. It contains saphenous branch of femoral nerve. So that is also the content, dear Ashwani Mishra. The incorrect statement is D. Yeah, it should be adductor magnus. Yes, absolutely right. It should be adductor magnus. The femoral artery exit through a hiatus in adductor magnus muscle, not the longus muscle. So please note down, femoral artery will take exit through a hiatus, and that opening is called as adductor magnus, not adductor longus. That opening is called as adductor magnus and not adductor longus. So here D is the correct answer, my dear aspirants. So adductor canal, which of the following statement? Okay. So which of these following statement about adductor canal is incorrect? So D is incorrect. So actually when we are talking, yeah, it happens. It's a common thing. It happens in hurry. We make a mistake. It is a very simple question. It's a communication between femoral and popliteal fossa is absolutely correct. It is bordered posteriorly by adductor longus and magnus is absolutely correct. It contains nerve to vastus medialis, and also the saphenous branch of the femoral nerve is traversing, but it is not containing. So femoral artery is not opening, is not passing through the opening of adductor longus, but it will pass through the opening of adductor longus. So this is the wrong statement. Now I would like, it happens, nothing to worry Ashwani Mishra, it's okay. Now let's see the boundaries. So when we are talking about the boundaries of adductor canal, it is bounded medially by sartorius muscle. So sartorius muscle is also forming its roof. Here also you can see here the sartorius muscle has been shown, which is medial, which is forming the medial, which is medially, or you can say it is forming the roof. Posteriorly, when we are talking, it is formed by adductor longus and magnus, anterolaterally by vastus medialis. So in transverse section also you can see adductor longus muscle is forming the posterior border along with adductor magnus, and we have got anteriorly, laterally, we have got vastus medialis. The contents which is residing. So yes, one of the few students has also told about saphenous nerve. So saphenous nerve, femoral vessels and nerve to vastus medialis, these are the important contents which is lying inside the adductor hiatus, which is also called as Hunter's canal or subsartorial canal, because nerve plexus is located below the sartorius. Okay, anterior division of obturator nerve, saphenous nerve, all these nerve to also medial cutaneous nerve of thigh, all these will form nerve plexus below the sartorius muscle, which is forming the roof. So we have got the content and we have got the incorrect option also. Let's move on to the next, that is question number 13th. A 34-year-old female has difficulty in abducting her right arm past horizontal position. An abnormal prominence of right Abnormal prominence of right arm above the, difficulty, the first point is difficulty in abducting her right arm past horizontal position. The second is abnormal prominence of right inferior scapular angle. So, which of the following is most important or likely the cause of patient condition? The options are thyroidectomy is the reason, anterior dislocation of shoulder joint is the reason, violent stretch between the head and the shoulder is the reason, clavicular fracture is the reason, or mastectomy is the reason. So, I will provide you 30 seconds, mark the correct answer. Please mark the correct answer, you will get 30 seconds for marking it correct. So, yes, Supra Pal is telling Van Pan, okay. Vein artery nerve, okay. So, tell me the correct answer for question number 13, all of you. So, I am getting answer already. Amit Behra has given his answer B. What about others? Then I will come up with the explanation. Imtiaz Hussain is given E as the correct answer. Ashwani Meshra is also telling E as the correct answer. Okay. Okay, so many of you are telling E as the correct answer and Behra is telling B. So, let me explain it, don't worry, I will give you the correct answer. So, first thing is that what is the abnormality? The abnormality is the patient is not able to abduct the right arm above the horizontal position. So, above the horizontal position abduction is not possible. So, can you tell me which muscle is involved here? Which muscle is responsible for abducting above the level of horizontal position? Which muscle? Can anybody tell me which muscle is responsible for abducting above the horizontal level? Which muscle? Serratus anterior muscle, also the fibers of trapezius muscle, but here serratus anterior. The other finding which has been shown is abnormal prominence of right inferior scapular angle. That is the another point about the serratus anterior muscle. So, now everyone absolutely correct. So, now with this description it is clear that the muscle being involved is serratus anterior muscle. तो अभी क्या क्लियर हो गया कि serratus anterior muscle is the muscle which is responsible for abducting above the level of horizontal position. So, that is cleared by this explanation that the correct answer should be serratus anterior muscle. Now, my dear aspirants, we know that serratus anterior muscle is running over the medial aspect of the chest and it is getting innervation. Serratus anterior muscle is getting innervation by which nerve? Long thoracic nerve. Long thoracic nerve, which is a branch of roots of brachial plexus. Branch of root of brachial plexus having the root value ventral rami of C5, C6 and C7. So, this is the whole detail. So, whole of it, yes, overhead abduction involved hai. Muscle pata ho gaya, which muscle is involved we are knowing. We are also knowing about the innervation. So, let us move further. So, let us see here. So, my dear aspirants, yeah. So, the patient described in the question is having the symptom consistent with the paralysis of serratus anterior muscle due to involvement of long thoracic nerve. Paralysis of serratus anterior muscle has got a classical presentation. The classical presentation of the abnormality is, first, when the person is asked to press anteriorly against the wall, the presentation will be the prominence of the medial border of scapula, and the prominence of medial border and inferior angle of scapula is called as winging of scapula. So, winging of scapula will be seen. Yes, absolutely right, Amitabh. The second presentation or the second abnormality which will be seen in this condition is the patient will also have serratus anterior muscle paralyzed. So, the overhead abduction will be involved. So, it is involved for abduction greater than 90 degree. So, overhead abduction will be involved. So, now the next point is how it is injured. Okay, my dear aspirants, we know that The nerve involved is long thoracic nerve, and long thoracic nerve can be injured. The mechanism of injury of long thoracic nerve occurs generally during penetrating traumas or iatrogenic injuries when the axillary lymph node is taken out. So when we want to go for a surgical treatment for the breast cancer, we go for radical mastectomy, and in that case we remove axillary lymph node. In that category there can be injury to the nerve, that is long thoracic nerve, and it will lead to paralysis of serratus anterior muscle, and that is the presentation which is given here. So we have to choose one procedure which is involving the involvement of long thoracic nerve or injury of the long thoracic nerve. Mastectomy is the procedure. Thyroidectomy is not the right answer. The reason is that if it's the procedure, the involvement is of recurrent laryngeal nerve or external laryngeal nerve. Anterior dislocation is not the right answer. अगर anterior dislocation होता है तो axillary nerve is involved. Violent stretch of head and shoulders will lead to brachial plexus involvement. Okay. Upper trunk brachial plexus. Okay. Clavicular fracture generally is not involved by any nerve injury. So mastectomy is the correct answer. Thank you, Amitabh. Let's move on to the next, that is question number 14. The type of structure shown in this histological slide present in which of the following structure? So the type of structure, firstly you have to identify this histological image. The first thing is identify this histological image and then tell me this histological image is which type of cartilage you have to identify. Okay, pehle identify karo type of cartilage, that is the hint which I am giving to you. Whether it is hyaline, elastic, fibrocartilage, articular cartilage, then you tell me the example of it. So I got an answer from Behra, it's A. I got an answer from Kadam, it's C. So yeah, so mixed bundle of answers are coming up. Mark the correct answer. Imtiaz Hussain, D. Okay, so all of you have given a mixed bundle of answers. So hyaline cartilage to sabne bola hai, hyaline cartilage. Okay, why this is a hyaline cartilage? Why this is a hyaline cartilage? Can Ashwani Mishra is telling C. So, okay, if it is a hyaline cartilage, all of you are right. Yes, it is a hyaline cartilage. That is a correct answer. So, why it is a hyaline cartilage? My question is why it is hyaline cartilage? See here. What are these? So, these are cell nest. So, actually chondrocytes are, if you will see the arrangement of chondrocytes, if you will see the sorry, if you will see, yeah, glossy appearance तो है, that is important. लेकिन basically most important point जो दिख रहा है वो cell nest है, isogenic group है. So chondrocytes are arranged in isogenic group. Yes, you are also right, that is basophilic appearance is there. What is this? There is presence of perichondrium. So yes, we know that in hyaline cartilage there is presence of perichondrium. Chondrocytes are arranged in the isogenic group that is called as cell nest. So we have to choose the example of hyaline cartilage. So now coming to the explanation, can you tell me pinna is an example of which cartilage? Pinna is an example of which cartilage? Pinna is an example of elastic cartilage. So this is wrong. Okay, intervertebral disc and articular disc are example of fibrocartilage. These are example of fibrocartilage. Yeah. Fibrocartilage, so these are also wrong. So the correct statement will be, the correct is epiphyseal cartilage, which is an example of hyaline cartilage. So epiphyseal cartilage is the correct answer because it is an example of hyaline cartilage. So the correct answer will be C. So is everyone okay with this explanation? Have you understood? Everyone have understood this option, this answer? So same diagram, elaborate one, cell nest. Okay, cell nest is there. Slide of hyaline cartilage. Perichondrium is present. Perichondrium, which is giving nutrition to chondrocytes. Basophilic appearance. Got it? Everyone, is it correct? Okay. So can we move on to the next MCQ? The next MCQ is question number 15. Okay. True statement regarding red pulp of the spleen. True statement regarding red pulp of the spleen. Which of the following statement is true statement regarding red pulp of the spleen? Perisinusoidal macrophages. Periarterial lymphatic sheath, B cells containing lymphoid follicles, or none of the above. True statement about red pulp of the spleen. 4 options are there. Mark the correct answer. Your time starts now. Mark the correct answer. I got an answer from red pulp. So the hint is यहाँ पे red pulp का content बताना है. Okay, the hint is that you have to focus on this topic, red pulp of the spleen. Which of the following structure is the red pulp of the spleen? Imtiaz is telling A, Ashwani is telling C. Mixed bundle of answers are coming up. So yes. Few seconds more. Okay, I got an answer from Pal also C. What about others? Okay. Right and wrong doesn't matter. What matters is the explanation and understanding every day something new. Okay. Revision, studying every day, that is important. That doesn't matter that whether the answer is right and wrong. That matters after few revisions. Okay. So only I come up with revision sessions also. So yes, I got a Supriti Pal is telling C. So mixed bundle of answers are telling. Actually the correct answer is A, perisinusoidal microphases. My dear aspirants, जब हम रेड पल्प की बात करते हैं, सो रेड पल्प इज मेड ऑफ स्प्लीनिक साइनोसाइट्स which is discontinuous fenestrated capillary. So which sinusites means discontinuous fenestrated capillaries, which is having discontinuity not only in the endothelium but also in the basement membrane. Okay, red pulp. Now, other than that, red pulp also contains macrophages which will phagocytize the old worn out RBCs, macrophages. It also contains plasma cell and it also contains reticular fibers. Okay, so all these structures which I have written, splenic venous sinusoids, macrophages, plasma cells and reticular fibers, all these are the contents of red pulp. When we are talking about white pulp, the white pulp is made of lymphocytes. The white pulp is basically made of B cells, lymphocytes. And in this, so also B cells and few T cells are surrounding the central artery. It also contains central artery, but the central artery location will be eccentric in position. So this is the constituents of white cells. So we have got A as the correct answer. So periarterial lymphatic sheath is the area which is surrounding central artery, and basically it is containing, periarterial lymphatic sheath will contain T lymphocyte. Please note down, periarterial lymphatic sheath will contain T lymphocyte. This is the area which is exactly the lymphocyte aggregation which is around the central artery. So lymphocyte aggregation around the central artery is consist of T lymphocyte, and this is called as pulse, PALS, pulse, periarterial lymphatic sheath, pulse. So let me show you the slide of spleen. So this is the slide of spleen, and in the slide of spleen you can see red pulp and white pulp. So this is what? This is white pulp, this is white pulp, this is also white pulp, this is also white pulp. Can you see there is location of central artery here? This is central artery, this is central artery. So what you can appreciate that the central artery location is eccentric. The central artery location is eccentric in this lymphatic aggregation. Okay, lymphatic aggregation, or the rest area, these all are the red pulp area which is made of macrophages, plasma cells and sinusoids, which is discontinuous fenestrated capillaries having discontinuity in the basement membrane also. That is important for phagocytizing the old worn out RBC. So here the correct answer will be A, and the correct answer was given by Imtiaz Hussain. Absolutely correct, Imtiaz. You were absolutely correct. So all of you have participated very well. But I also, this is exactly the other slide where the spleen whole histological slide has been given. You can see lymphatic nodule, central artery, you can see the outer fibrous capsule, you can see the trabeculase, you can see the white pulp having the germinal center, which is the light color stain. Actually germinal center is containing immature lymphocytes. Okay. So my dear aspirants, before ending the session, I want you to give an information about my session. So I am having my 11th session, that is 4:30 p.m. May. The session is on the Unacademy platform. So this session is going to take place at the Unacademy app. For this you have to download the Unacademy app. You can use my code ANAT10 to unlock the session and be present for this live session. So ANAT10 is my code which can be used for unlocking the free session 4:30 p.m. 31st December. ये लास्ट सेशन है, उसके बाद आप इंजॉय कर सकते हैं. ऑल द बेस्ट फॉर द कमिंग ईयर 2022. आई गिव यू ऑल द ब्लेसिंग्स. आपके सारे ड्रीम्स विल बी फुलफिल होंगे, बट वो कैसे फुलफिल होंगे? ड्यू टू कॉन्स्टेंट स्टडी, रिविजन, डिटर्मिनेशन एंड ऑल. सो लेट्स टेक वन मोर सेशन 4:30 p.m. क्विकली रिवाइज anatomy MCQs and then enjoy your day. Happy New Year to everyone, Ashwani and everyone, all the aspirants. So 4:30 p.m. if you want, you can join me by using the code Let's Crack NEET PG, and all the Unacademy Telegram group. The link of the session will be provided. Before ending the session, I want you to show this slide where the pricing detail of the Unacademy Plus and Iconic has been shared. You can have a look on this session and you can take the subscription according to your choice, whether you have to go for Plus or Iconic, that is up to you, but that will be highly beneficial and you can get a discount of 10%. Also, this is providing you 10% discount. Happy New Year, Imtiaz and everyone. A great New Year to all of you. Enjoy to the day today, and also all your hard work all your dreams are coming true. So let's focus on your study and be determined. Stick to your timetable. That is all what I want. All the best. Keep studying. Okay. So yes, before ending the session, yes, in advance, that also. Okay, great. So also I want you to show this. So when you attend the session on the Unacademy free platform, you can also download the PDF notes. So that is another benefit. So at 4:30 p.m. today, there is one session. You can be present live for that session. Okay. Do subscribe, like Let's Crack NEET PG platform, share, and also download the PDF notes on the Unacademy app, free special classes. All the best. Keep studying. Thank you so much. Let's meet 4:30 p.m. on the Unacademy app. Thank you. Thank you. All the best. Keep studying. Thank you so much. Thanks everyone.